Good afternoon, everyone, and welcome to today's Rural Community Sector Telebriefing. We'll get started in just a few minutes while folks finish joining us. Enjoy the music. Good afternoon, everyone. Welcome to today's Rural Community Sector Telebriefing. I'm Liz Walbrock, and I manage the Rural Community Sector for the County of San Diego's Department of Strategy and Community Engagement. First, a big welcome to those joining us for the first time, and to those returning. Thank you for staying engaged with us, and thank all of you who have already introduced yourself in the chat. We appreciate it. It's great to see the representation from so many different departments and areas of San Diego. Today, I will facilitate this meeting with my Rural Communities Work Group co-lead, Teresa Greenhall. She is the program manager for the Community Emergency Response Team, managing most of the programs in the unincorporated areas of San Diego. And for the past 4 years now, our team has worked closely with the Rural Communities Work Group and with your feedback to share timely, practical information. So we tailor our programming around public health and safety, centering community voices, and bringing in subject matter experts who can answer your questions in real time. Our recent telebriefing focused on a new flood warning system and a communities partners panel. It was a discussion on everything from food insecurity, behavioral health, to transportation resources. We've also included themes around climate change and how that impacts emergency preparedness year-round. So today, we are going to focus on Public Health Service's approach to extreme heat, including the newer Cal Heat Score early warning system. And we are thrilled to have a special presentation by our very own County Public Health Officer, Dr. Seyon Tihalole Pavan. Extreme heat is increasingly affecting all parts of San Diego County, and rural areas face really unique challenges. So our goal here today is to share tools, data, and strategies that help keep residents safe during a heat event that we should likely expect this summer. So today our telebriefing will start with announcements from Live Well San Diego and our partners. We'll have our presentation, and then we'll open it up to the audience for questions. And thank you to those who have already submitted questions to our inbox. Thank you. And if you haven't already done so, please introduce yourself in the chat box. And a few housekeeping reminders before we begin. This meeting is being recorded and your lines are muted. Please remember to submit your questions right here in the Q&A box at the bottom center of your screen. And if due to time constraints today, we don't get to your questions, or you want to reach out to our team, you can follow up with us through the email address right here on the screen, and we'll also share it in the chat. If you'd like to receive the recording of today's telebriefing and other communications related to rural communities, please sign up for our email updates by clicking on the link shared in the chat box as well. Okay, let's get started. Today's announcements. Let's continue the conversations from today by going to our virtual connection hub. Our page includes 3 great tools to connect with one another and us. And we'd like to highlight one tool and give everyone a quick minute to add your organization to our map. This is a great tool to see who else has shared their organization already. You simply click Go to Map, view the map, and then click the New Pin button. And you can add your organization and your address. And if you'd like, you can even add a picture and a comment as well, introducing what your organization does. So we'll also drop the QR code, or you can use the QR code on your screen to access that. Next, we have our virtual learning series. So this is a self-paced learning and engagement opportunity. We developed this learning opportunity after receiving feedback from many of you and others in rural areas about not having internet bandwidth to get onto live opportunities like this. So we created this on-demand option. So you can listen to important public health topics created by our Live Well San Diego recognized partners through a series of pre-recorded podcasts, and you can comment on them. June and the partners can also comment and answer your questions too. So June is Alzheimer's and Brain Health Awareness Month. So please be sure to check out the session next week when we launch on June 3rd. And you can scan that QR code and we'll send it in the follow-up email as well. Now I'll pass it to Teresa for community announcements.
Thank you, Liz. So everybody, we have a few community announcements coming up. First, we'd like to invite you to join Live Well San Diego, California Schools VIVA, and Do Good Leadership Collective for a free networking event for professionals committed to workplace well-being. Learn how well-being boosts decision-making, creativity, and reduces burnout-related costs. Gain practical tools to support teams and build meaningful connections through collaborative activities. We'll drop the registration form link in the chat, or you can scan the QR code for the event on your screen. Next up, this is exciting news for Liz and I were just talking about this. The San Diego County Partner Relay Team is sharing a critical update regarding their communication system. To provide regional coordination and tracking, the Partner Relay Team is transitioning its active incident emergency notifications to a new data-driven platform called Genesis Alert. When the team activates for an incident moving forward, here's what you can expect. The Alert San Diego system, emergency messages will now come directly through Alert San Diego and will feature the Alert San Diego logo. New translation process and automatic feedback poll. These changes allow the partner relay team with real-time insight into how emergency information is being amplified to linguistically isolated communities across the region. And then I wanted to share two that I had real quick. One is the June 6th, Potrero Fire Safe Council is hosting an educational fair from 9 to 2 at the county park. And then on June 27th, SDG&E is hosting their wildfire safety fair from 9 to 1 at Joe McQueen Middle School. So that's all I had. Back to you, Liz.
Thanks, Teresa. All right, now for our special presentation, I'd like to introduce Dr. Sayon Tihalolipavan, also known as Dr. T. He is the Public Health Officer for the County of San Diego and is a board-certified public health and preventative medicine physician and with extensive experience leading public health initiatives in New York City and San Diego. He holds a master's in public health from Columbia Milliman School of Public Health and a medical degree from New York University School of Medicine. He's been recognized with numerous awards, including the San Diego County Top Doctors Award in 2022 and the Kresge Foundation Emerging Leaders in Public Health Award in 2018, and has led or contributed to various peer-reviewed publications. It's an honor to have you with us today. I will pass it over to Dr. T.
Thank you, Liz. And hi, Teresa. Hi, everyone. Thank you so much for having me. And I'm just so appreciative that this media and this channel exists and continues to exist to really just have this bidirectional dialogue with to serve our rural populations, because we know that we do have to think differently and strategize differently amongst our, vulnerable populations across the whole county, and that the rural population is one we cannot leave behind. So I just appreciate this telebriefing series in general and the sector and all the communications between these meetings. So yeah, I'm gonna talk to you and just want to thank also the team, Adrian and Gayla, for helping put this together. Really around the health impacts of extreme heat. We want to talk about the Cal Heat Score tool, a new tool from the state. That is important. That is, even though it's a state tool, it is locally very relevant, and why, and then how to get involved. So let's get into it. In terms of the why are we even talking about this, right? Why do we need to talk about a tool, a new tool that maybe one more thing, one more app you have to download or website you have to look at? And really the answers, because there are tremendous impacts from extreme heat. I mean, you all know this. I know I'm preaching to the choir, and here are some of the public health impacts. So if you go to the next slide, it has a lot of when we talk about climate and the change in climate and all the impacts on human health, there's so many different categories. And I love this slide that we use from CDPH from the state, but that we adapt from. And so while there's other things that we can always talk about, like the changes in mosquitoes and mosquito-borne diseases, what we're going to talk about really is the extreme heat and the impact of that. And you may or may not know this, but extreme heat and heat-related illness is the number one health impact of climate change in the U.S., right? That's what we're seeing. We're seeing the most suffering. It's not like we're seeing like droves of people, getting West Nile virus all of a sudden, or hantavirus, which has been in the news. Really, what bread and butter, what the biggest impact from a day-to-day perspective is actually the extreme heat. So next slide. So who is at risk? Really, I feel like every time I give this presentation, the slide should be titled "Who is not at increased risk?" for heat-related illnesses, right? And I say that kind of, tongue in cheek, but it is real that most of us really are at risk for increased heat-related illnesses. I think when you think about heat, you think about sun and being outdoors. So it probably makes sense to you that outdoor workers, athletes, are at risk. But then also, it's people without the ability to cool their body, without the ability without air conditioning, people, with different metabolic rates like infants and children and who are more susceptible to outside temperatures, and then also people who are pregnant and chronic conditions, and that's because their bodies also may not respond as much and as quickly to changes in temperature over time. So next slide. So it's really most of us. And then, heat-related illnesses, just wanted to mention that this we are seeing and the data are clear, and I'll show you some that heat events are and extreme weather events are increasing over time. And we're seeing as a result increasing numbers of waves and intensity of heat waves. We know that, for example, we had a heat wave, I believe, in February this year already, and that was much earlier, right? And 10 years ago, 20 years ago, we would have never expected a heat wave in February of any year. And now, that's not too outside of normal, unfortunately. And then we know that there's rising temperatures, and those impact people's health, of course, and heat-related illnesses. And here's a number, 13,042 cases of heat-related illnesses in California from 2000 to 2020. Now, I want to be really clear that that is definitely a gross undercount. We know that, most conditions, right, when people go and some of them aren't coded or appropriately, things like that, when on the medical side. But then in general, we know that people are dealing with heat-related illnesses, but that may not be categorized as such. So people are seeing things like people being dehydrated, but it's not necessarily being medically, billed or coded as a heat-related item. So, the it's very, very, very likely, and I could say with 100% certainty, actually, that that is undercoded. And when we talk to our medical community, they say the same. So just use that as a one example, but as you see, even that number itself was significant. And so now let's talk about how the heat impacts our health. So there are things, I know you've all heard about heat exhaustion, heat stroke. And this is really the results of our bodies are meant to stay at a certain temperature, and we do everything we can, and we have all of these little mitigations that are happening in our body and adjustments, when we're in too cold climates or too hot climates. But if you are in an extreme temperature climate, for too long, your body can only compensate for so long. So what happens when your body can no longer compensate? What are those signs and symptoms as you're getting to that point of no longer being able to compensate? And that's what's impacting us and our bodies in these extreme heat events. And that's what we worry about, and leads to things like heat exhaustion, heat stroke, and that has real damage. That can damage not just us, and have symptoms that I'll talk about in a slide or two, but also have end organ damage, which is, damage to our vital organs like our brain and other things. Next slide. I think, yeah, these are some of the symptoms just to distinguish second, between heat exhaustion and heat stroke. And you see that even the first few symptoms actually are shared or common, and as well as vomiting at the end. But there is a significant difference. Heat exhaustion is where, your body still is responding, is still doing some things in response to the heat, and you're cold and pale and clammy, versus heat stroke. Your body is past beyond, that ability to really do any mitigation. And so then here you are not sweating, you're actually red, hot, and dry skin, as you see here. So all of these can lead to, like you see here, headache, nausea, dizziness, vomiting, fainting, confusion, things like that. But you see there's significant differences. But either way, these are emergencies. You move people to cooler places, you call 911, and then you take these steps here, like loosen clothing, put out cool, wet clothing on bodies, sip water, get medical attention. Okay. And the one thing I want to say is heat stroke, we actually do not, the one significant difference is you don't want to give the individual having a heat stroke water. And this is why you call 911 immediately, right? They'll be able to walk you through this and talk you through this, and give you guidance over the phone. Thank you. Next slide. And these are some of our data showing just in San Diego County and, over several decades, 30 years or so, looking from 1991 to our most recent available data, just the number of hospitalizations for heat-related illnesses or injury. And you can see a clear trend pattern, right? Any year to year, there might be differences, but when you look at the trend line, which is that dotted line, you see there's a clear positive trend, unfortunately. Right. So we know that this is an increasing issue. Next slide. And then here are steps to stay safe. And really the biggest thing is keeping your internal temperature, at the sweet spot, at the regular areas. And that's doing things like avoiding outdoor activity when it's limiting when it's hottest, and then taking frequent breaks, and then stay in an air-conditioned place, of course, wear loose, light clothing and sunscreen, and then definitely do not leave kids or anyone else in the car, that. And then staying hydrated, of course, and there's water, but then there's also, if you ever have see in the grocery stores or something like the IV drinks or whatever it's called, and where they have more electrolytes in them and you can mix them in, those are recommended, of course, knowing that if you're going to go into an atmosphere, if you're working outdoors, if you're doing gardening or outdoor chores, or it's something that you can't avoid, you want to try to use fluids like that with electrolytes. Stay informed, and that's what we're going to get to. And Cal Heat Score is one avenue to do that. There's many, of course, areas to do that, and we are putting out heat messaging. We know through the rural sector, you all are amplifying a lot of the messaging, which we appreciate as well. And then Project Relay, which I heard talked about earlier, helps amplify messaging, especially through CBOs and other partners to vulnerable populations that may not speak English as their primary language. Next slide. Of course, the news. Okay, so this is kind of the way that we in public health and our small and mighty team that works on this, Adrian and Gayla, how we really think about, and myself, of course, how we think about our approach to climate action. And so there's we use the state model, the brace model, and you see here to build resilience, right? So it's comprised of these different components, getting ready, staying ready, partnering, because we can never do any of this alone, listening, assessing, investigating, prioritize, planning, and taking action. And you see, I love the themes in the inner circle of collaborating, communicating, and evaluating. So I think that simplifies it, and I think that's what we're always trying to do with our community partners to make an actual impact to the lives and the people who need it. Next slide, which is all of us. So these are just climate vulnerability app, and you can click on the link when you get a copy of these slides to see this yourself. But you can see here that both when you look at climate hazard and social vulnerabilities, there's two different ways of looking at data, and social vulnerability, measured by various level factors from income to other things, and then how much the climate impact is on those areas. There, you can see where those two overlap, meaning that people may be more susceptible because of their socioeconomic status and social vulnerability to impacts of climate change. For example, cannot have an air conditioner in their home. And we know many homes in San Diego don't have air conditioning, don't have access to, other things like that. So the next slide, and you could see here that, oh, sorry, you can go back one. You can see just that, there's a lot of our county, and we are a really, really large county, but, much of our county does have the dark purple for climate impact or climate hazards. And then much of our county also has what I would consider pink and to brown, I would say orange and brown, that shows that intermix or that intersectionality, I would say, between the social vulnerability and the climate hazard. Next slide. Which are areas we have to be even more mindful of. So this is our last, in terms of planning and reading up on anything local. We do have a heat response plan and a excessive heat report. I see it's for 2023. I know that our team is catching up, and I just approved the 2024 one, so that should be out anytime soon. And then we know we're making changes to make the 2025 one way more kind of user-friendly and simple, and really just to get the main points across. So that should be coming out following even soon after the 2024 is released. Okay, and next slide. But those do talk about planning. So now to talk about Cal Heat Score. So has anyone, just by show of hands, heard about this as a tool? See, Teresa, Elizabeth, I'm not counting you two. No one else? Okay. Okay. So great. Yeah, that's why we're here, right? So this is not something that the county funds. I just want to be clear. We are just sharing a tool, like you would tell your neighbors about a wonderful resource that you just learned about or something like that. We just want to share good news. And so the state has been investing for the last few years funding into this, right? They know that things like fire and heat are the new reality that we're extreme heat are the new realities we live in, and so their goal is really how do we equip Californians to better be knowledgeable and in more of a real time scenario, like how we get the weather every day, but in a way that could actually change people's behaviors in a way that's mitigative or preventative or allows for mitigation when there are extreme heat events. So, I can go on and talk about it, but we actually found an amazing video that talks about it really well. So if you can go to the next slide, and if you play this video, it is a few minutes, but this has a wonderful overview.
Extreme heat is a growing public health threat, killing more people than any other weather-related hazard. The good news, heat-related illnesses and deaths are preventable. That's why California developed a statewide extreme heat ranking system that raises awareness and warns people in advance. Cal Heat Score is our free web mapping tool for anyone in California seeking up-to-date information about heat events. Its mission is to protect the health and well-being of all Californians from extreme heat, especially the most vulnerable. Cal Heat Score works like a basic weather app. It shows new information every 24 hours, mapping current and upcoming heat conditions for every zip code in California. It uses hyperlocal data to provide a better picture of who's most impacted where. Cal Heat Score translates this data into easy-to-understand heat scores so you can quickly see when temperatures might become dangerous for you or someone you know. Cal Heat Score uses a scale of 0 to 4, where 0 is low risk and 4 is severe. As the score goes up, the potential impact to communities increases. Higher scores means it's time to take notice and consider taking precautions to stay hydrated and out of direct heat if you can. Let's look closer at the site calheatscore.calipa.ca.gov. You'll start by clicking Cal Heat Score Mapping Tool at the top. On the left side of the screen, there's some basic information on how to use the map. We have a legend here that provides color coding of Cal Heat Score. Orange and maroon indicate higher risk. To search a specific area, type the city name or zip code in the search bar. Let's try this city. Clicking the location opens a main panel with more information, like today's Cal Heat Score forecast, how many people live in that zip code, and the forecasted highs and lows. At the bottom, you'll see 2 tabs with local population info. The first shows age, race, and ethnicity. For example, a larger Pop 65 Plus means more older adults are in this community. The second tab highlights more groups impacted by heat: outdoor workers, people who are linguistically isolated, and those without health insurance. You can also find local resources. Toggle the Cool Center button, and you might see some near you. It's not a complete map of cooling centers, but it's a starting point, and we're working to add more over time. Let's look at this city. What's considered hot in one place might not be in another, and Cal Heat Score takes that into account. In this city, summer temperatures are usually higher than in another city, so it takes higher temperatures to trigger a higher score. This localized approach makes the tool more relevant for California's diverse climates. At the top, you'll find other sections like guidance, resources, and partners. There's a feedback tab where you can take a short survey or join our email list. We're working to improve Cal Heat Score regularly, and we want to hear from you. What kind of data and resources would be helpful to see on the map? What sort of information helps you, your loved ones, and your community stay safe during extreme heat? Your feedback helps us make Cal Heat Score more useful for everyone. Give it a try and let us know what you think.
All right. Thank you. Thank you, Vivian. So any thoughts from watching that? Anything that anyone wants to share or in the chat? Right. I think, oh, and good comment, Bridget. Sorry, I'm just seeing that now. Looks like backcountry is extremely impacted. Yes. So this is some of the highlights of what you heard in that video, and hopefully, you got a better sense of, and is that this tool has the ability to do localized alerts that are tailored for the local. He even talked about, this being localized in terms of there's relatively like what is hot here. Like I have a friend who just moved from Arizona here to San Diego, and she's like freezing today or these days. And so everything's all relative, right? And so then daily and forecast updates, protective rankings, and that is wonderful using ER data and regional climate conditions, targeted outreach, and resource connections. I see in the chat that many of us here are part of like CBOs or organizations that may work and with populations to support populations who may be vulnerable populations, older adults, and other groups. And of course, we all have limited resources. We all have limited time. And so how do you prioritize which communities you're going to work with, right? In order or which need have the highest need. And these are tools, just like that map I showed you earlier, that can help you, think through, right? If you're going to have X amount of days and you want to do this amount of outreach, you can go to these communities, and maybe you might want to prioritize this one over that one because they not only have climate impacts, but they have a social vulnerability aspect as well. So things like that. So, and I'm seeing some things in the chat. Yeah, asking people to avoid fragrance. Is that cool? Yeah. And then love the local data. Thank you. And this might be helpful warning for hikers. Yeah, that's true. And connecting air pollution. If I can ask on anyone on the team, HSA team, if they know if air pollution was connected. I thought either it was already or it's going to be, but I feel like that sounds familiar. And we did, just so you know, the county and we did actually meet with the state, including Elizabeth and others. Like we did meet with the state folks who were creating this tool, and we gave them some feedback. So initially, for example, our cooling centers that our public health preparedness and response team facilitates used to be AIS, cool zones. Those were not on their lists at all, and so we now get that on the list, and we have the that connection with them to update that. So thank you. Next slide. And then, oh, this is even just additional ways of kind of using it, for different audiences. So, for the general public, it's just good. It's like watching the weather every day, right? And how do you decide and make point of pointed decisions depending on like the information you're seeing. But then it's helpful for us in government or healthcare workers or employers or CBOs as we're working with our various populations we're serving or employing. And then this is their information. You can go to their website. You could download you could look at the tool. They actually it's not on these slides, but they just last week had an announcement that they now have what's called API for any of you kind of like tech nerds that they have this interface or the ability to for community groups, et cetera, to put the tool on their website. And so you can feature that, how you can like have it directly on your website and things like that. So there's now that ability so that way this gets more reach, right? It still goes and uses the same database, but now it could be on a trusted website like yours if you're a community group, right? Like I saw Red Cross or SDG&E or others on here. You can put this on your website. So, and then next slide. And then additional ways to get involved I mentioned cool zones, and we're always looking for additional cool zone sites because we know more access is better. So if you're interested, please let us know. We know historically the cool zones have operated, I believe, June through October, and anyone could correct me if I'm wrong. So we're trying to expand. We know the reality, just like I mentioned earlier, February we had a heat event, so we are operating and starting earlier this year. We've already started. So as you see here, May 11th. So, but we know that we need to ultimately, I know that I need the team and us to be able to just open whenever there's heat events, right? We need to let the temperature and the weather dictate when cool zones are open, not be limited just because of how we, have partners and stuff. So that's where we want to go. But right now we're slowly expanding like to May this year. Next slide. And then, of course, sign up for health alerts. We just put out one actually today on e-bikes, if interested. But we did put out one last year on heat as well, extreme heat effects. And this is more for the medical community and the public health community. Next slide. And then, yeah, share key messaging. So this is great. Heat Ready California is a wonderful website that has a lot of that simplified messaging that you can use to share with your audiences and clients and communities. Next slide. And there's a curriculum, so you can be an SME if you're not already a subject matter expert. And so this is a very kind of easy to use and access curriculum that's free. There's 6 modules, and the team worked with many others to do this. And if you use your phone to check out that QR code, and again, you'll get a copy of these slides too, you can participate on that, and that's through our website at no cost. And then these are several other resources, and with that, and all of them are useful. And with that, wanted to open it up to questions or see if there's anything else in the chat. So thank you. One. And I see, there's one question. Are cool zones, sorry, I moved. Are cool zones integrated with wildfire refuge centers, and could they be used to develop pedestrian evacuation routes? I don't know
So
that.
Dr.
Yeah, go ahead.
Dr. T, may I jump in? What do you mean
Yeah.
by wildfire refuge centers?
Maybe you can unmute
Whoever
yourself.
put that in there,
Yeah.
that's what I'm wondering. Oh, let me see, did they answer that?
Evacuation sites.
Okay. Hmm.
So there is a possibility that there will be overlap, but I think it depends on where the fire is, and then the incident command, of course, and assessing the resources that are needed for that
Right.
that community, where the evacuation zone is, things like that. Sorry, Teresa, please add.
No, that's okay. And there are 2 different agencies that would operate those, right? So Red Cross generally sets up the evacuation shelters, where the county then sets up the cool zones at libraries. And so, so I don't know, if there was overlap, I'm sure you could go to the evacuation shelter, but they're looking for evacuees at the evacuation shelter because they're going to have to feed them meals. And it's generally for people that evacuated, not a cool zone type of operation. I don't know if that helps or not.
Yeah, thank you.
Mhm.
Um, and then the further input was the community has people without vehicles. Yeah, which is part of that social vulnerability, right? And then there are no pedestrian evacuation routes.
So, Dr. T, there was a question in the Q&A box from Anna with Seaport Scripts. She asked, our patients are homebound. Are there resources to help rural patients access cool zones if they lack transportation? I think that's something we need to research further because there were previous programs. I don't know if there still are. So I don't want to give a hard answer on that unless you have a current update. I'd rather not give a hard answer on that till we have time to research it and then get back to everybody.
I don't. I think I saw someone from AIS. I know that we have a call line that AIS Aging and Independent Services still supports. But my understanding is that for folks who are on Medi-Cal, that this may qualify for what's called a non-emergency medical transport port, and so you can call your insurance plan and ask for transportation, and that may be an option. I think sometimes these things are easier said than done, and um, we've heard some challenges with some people trying to make those use the non-emergency medical transport option. It's a benefit, like it's already part of your health insurance. So it's not a new thing or an extra thing or anything like that. But that's only for people with Medi-Cal, right? And while that's a critical group, that is not everyone. So it's a very valid question,
And
Anna.
sorry. And I think 211 is a great resource. So they have stuff prior to, during disasters, after disasters, all kinds of resources. So that's also a good one. You can call 211. You can go online and look up 211 San Diego. And then they may have partner agencies that provide services at no cost or minimal fees during disasters. So they may have access to agencies that we don't know about.
Thank you. And I see some other questions too in the chat. One is, how does relative humidity relate to scoring methodology? I believe that humidity is part of the scoring. How does it refer? I don't know if I could ask Adrian or Gayla, or I can look up honestly after I'm done. Just that there is a part on um, the Cal Heat Score webpage that talks about like how they come up with that score.
Mhm.
Adrian, do you want to? Sorry.
Oh, yes, it's in the chat, a couple comments down. I
Oh,
added
thank you. Sorry.
and it's the relative humidity is part of the maximum humidity.
Oh, perfect. Okay. Thank you so much. Oh,
And
yeah.
yeah, thank you so much for this. The Aaron Xavier, thank you for sharing this new tool that came out just this week. Um, that
Oh, thank you.
supports the
Yeah.
Tribal Climate Health Project. I'm looking that up now. If
And
people on the call have other resources that we haven't talked about, please share. So you don't know what we don't know.
that's great, Aaron. Thank you. And I
Yeah,
know
and
the,
Matt put in the link about cool zones at San Diego County to get more information. People can email that. Thank you, Matt.
great questions, everyone.
So there's a few more questions that came in prior to the meeting. So are you ready?
Yes. Yeah.
Okay, so this one I like. It's what steps can communities take? So a community take to help keep each other safe during times of extreme heat in their areas. So I like that whole community concept.
Yeah. Several, I would say. First of all, just from a planning perspective, of course, not all the areas that we live in would allow for this, but we can do things like build more shade and like plant more trees and things like that, like sometimes, right? Like, and just change the landscape so that there are more opportunities for and cooler temperatures. We know that there are things like urban heat island effect, which raise the temperature of certain areas, sub areas or micro areas. And so that's one thing from a community like upstream thing. But then really the community like is we need to be a community, right? And not just live in our isolation and actually check on each other and, have your people, have your phone trees, making sure, especially if you know that people are vulnerable, if you have your, grandpa living alone or something, or you have someone down the block who's pregnant, or with little kids and things like that, that we are mindful and that we are incorporating them when things are hotter, just to check in on them, ask them if they need help. Do they need a ride? Who doesn't have a car? Since it was mentioned that not everyone has transportation, and have access. If you have neighbors that don't speak English, right? Like, how are they getting the message? Now I know I feel like so blessed because like on my phone, I have a Google phone, but I have this Google Translate app and I'm not paying anything extra. I just like talk to it and I could say which language and it automatically spits it out in whatever other language that might be specific for phones. But there are things like that and opportunities like that. I definitely want to open it up though to others. I'm sure I'm missing some other ideas from Teresa, you or Adrian or
Yeah.
others. Yeah.
So I'll jump in. And I'm glad you mentioned trees because the county has a tree equity program, right? So the county's climate action plan team, but they also, in certain areas of the county for lower income, there's assistance with getting solar panels. So if you have a house that doesn't have air conditioning or needs some boost, there's a lot of programs. So we'll try to get the links to all those great programs that we can include in the follow-up email because check and see where you qualify, but there's free programs or assistance in helping to cool that overall canopy down or the heat with the tree canopies and other programs. So I appreciate that. We'll add that in the link. Thank you. So here's there was a question that was submitted about what temperature needs to be reached in order for extreme heat to be declared. So let's talk about San Diego County because I know that you guys, the Cal Heat Score talks about it individually, and they showed, Fresno, where my friend Carla Glazebrook runs the CERT program up there, and it's extreme heat a lot. And but what is the extreme heat index for San Diego County? Do you know?
Yeah, I don't have that off the top of my mind, but I'm
Okay.
pulling up our report and then I know we have Valeria or others who may know, but I'm gonna pull it up. Give me 1 minute.
Okay.
Um, I apologize. I should probably know that. Uh, through our report if we have the thresholds, but I don't see. Um, And really, a lot of it, I will say, is we're blessed to have a National Weather Service and the regional one, and they're the ones who usually indicate to us
Mm.
when they meet that heat alert versus a heat emergency phase. And so, but I don't know why I'm not finding the thresholds, but there are thresholds.
That's okay. We'll try to find them
Okay,
and follow up.
sorry.
That's okay. This one may actually be some of the other partner agencies that we have on this might want to weigh in on this. So, do any San Diego organizations give out cooling materials to communities such as handheld fans, water bottles? Um, I don't know if
Yeah,
you know of any or
I don't.
Matt with
I'll defer
AIS.
to
Mhm.
folks on here, but I also just want to say sorry. We've been talking about heat events and heat emergencies. What I did not emphasize today is that also the thing to be concerned about is when you have overnight temperatures that do not cool.
Oh.
And so then that is another, I think, a compounding factor and vulnerability when your body temperature does not have that recovery period, right? Just like going inside, it's like overnight, cooling your body down for several hours. So that is another vulnerability to watch out for when you're hearing on the news, that it's not just hot, but it's hot at night and overnight. Sorry.
Thank you.
You say, Matthew.
Rosalinda, you have a question? Your hand's up. I'm so sorry. Are you still there, Rosalinda? Your mic's off.
I think I've heard that all the attendees are on mute.
Rosalinda,
So type it.
go ahead. Did you have a question?
You said she does not have a question in the
Okay.
chat. Yeah.
Oh, okay. Just your hand was raised. Okay. Thank you. They talked a little bit about people working outside. So this is a question, and we recently did the training with county, right? So there was great information on this. But if you're working outside, are there any recommendations to acclimating to the heat? Because maybe we haven't been working outside for a bit, and now all of a sudden we've got whether we're doing defensible space and it's hot in March, or so is there any recommendations to acclimating to the heat if we haven't been out working outside for a while?
Yeah, definitely. I mean, if you're going outside, it's kind of like starting a new workout plan, right? And like if you haven't been working out and exercising, and then all of a sudden, and you might hear on when some of these ads or when you're joining a gym or something, like check with your doctor first. That's something. So I'm saying as a physician, that's why it's always better to start slow and steady, right? And ease into it. So, but if you have that luxury, of course, we know that some people are in situations where, let's say you don't have a job, you're unemployed, or something happens and you get a job and you all of a sudden have to do certain things during certain hours. That's of course different. But if we're to the extent that you can control it, yeah, like if you're all of a sudden taking up gardening after never doing it or not being outside much, do it in the hours where it's not, outside of that, what is it, that 10 to 3 hour timeline where we know the highest constant, the sun is more directly on top of us and things like that. So try to avoid that middle of the day. Try to wear that loose, light-fitting clothing. Take breaks, stay hydrated, things like that, just to ease into it and get your body acclimated to it because you're pushing your body in different ways, and you don't want to overly push your body, just like running a marathon or running a 5K, even like after never running, it's something like that. So you want to ease into it.
Okay. And there's kind of a follow-up to that on drinking more water, right? And so some people will chug a big glass and then they go work outside.
Yeah.
Should they have water with them maybe and drink smaller amounts throughout that hour or 2 hour period, and not like chug one and then 2 hours later chug a big glass and think that they've checked the box?
Yeah. Yeah. You definitely want to hydrate before, right? It's kind of like, if you have a big day coming up, you want to be well rested before you start your day, right? So by the time you're actually outside and then you start feeling thirsty, thirst is already a sign that you're dehydrated. I'm dehydrated right now. That's why you saw me drinking water and stuff. So like, you ideally you would want to, I wouldn't say chug, but you want to like, keep up and just drink throughout the day before you're outside. And then, of course, yes, also have some outside and to keep replenishing what you're losing. Because if you are sweating out in the extreme heat, you're going to be sweating. So you're losing water. So you want to replenish that as much as possible and preferably with electrolytes.
Okay, and that was another question about electrolytes, good, bad. I hear people say, oh, that liquid IV.
Yeah, I mean, that's one, and I'm
Mhm.
not promoting any brand or
Right.
anything.
I'm
I
not either.
apologize, but the yeah, but this just came to mind because I see it so everywhere. But there's so many others, and I will say, of course, like especially if anyone is diabetic or anything like that, some of these other like the Gatorades and some of those kind of have a lot of sugar in them. So like as much as my kids love that stuff, and as much as they're advertised as sports drinks, they're actually a lot very sugar watery. So that's why I prefer personally like the tabs that I can mix in my water or like the liquid IV, like those types of things where it's not really calorie dense or like sugary. Um, but if you're doing it once in a while and it's not a medical issue, like you're not diabetic or something, then that could be okay in moderation. But just want to be careful of that. But electrolytes do make a difference. I mean, that helps you absorb nutrients. That helps you, and that's what you're losing when you're sweating. So you do want to replenish that.
Perfect. Thank you. And Jesse Rose had a good comment about, let me see if I can find it. Always best to start hydrating the night before. I
Yeah.
recently read something and it goes back to what your comment about training for a marathon, right? You just don't jump in. And so I had read recently that what you're drinking today is really helping you 3 days out.
Mm.
So
Yeah.
so if you're behind now, you think you're getting caught up, but really where are you going to be in 3 days, right? So
Yeah.
are you
Yeah.
really
You don't
getting
want
caught
to
up? Mm-hmm.
enter already in a deficit. You're right.
Yep. Okay, there were a couple more questions, but I think, Liz, it's time for us to wrap up. Is that right?
Yeah.
Yeah, and for all the questions that we weren't able to answer today, don't worry. We will talk to the doctor and Adrian for their input later, and we'll include it in our
Yeah.
follow-up email.
Thank you, everyone. Appreciate you all and everything you all do for the community. So appreciate it.
Thank you for the great presentation, Dr. T and Adrian and Gilla. Also, thank you to our support staff, Kitiara, Vivian, and
Yes.
Tiffany for supporting these telebriefings and making it as seamless and collecting all the information for us to use later. So also, always be on the lookout for time-sensitive updates and resources through our email communication. Again, subscribe for our rural updates right there. The link's in the chat. And that's all our time together. So thank you everyone for joining us, and we will see you soon. Thank you.
Thank you, Dr. T, and everybody, Adrian.
Thank you.